Hello, I'm Dr. Manoj Goel. I'm Director of Pulmonology and Sleep Medicine at Fortis Hospital, Gurgaon. So, sputum examination is very important and it is very inexpensive. It's widely available and it's the first test that we recommend if somebody is having pulmonary tuberculosis, that is the tuberculosis of the lungs. And it can be easily done even in peripheral areas. In a small setup, a small lab, it just needs a microscope and some, staining material. And the TB bacilli can be, easily diagnosed, can be easily detected. The problem with the sputum examination is that many times we don't get a good quality sputum. People, give their saliva, which may not be representative. So it has to be a deep sputum coming from the lungs. And once it is tested, then it can show the tubercle bacilli. And once it is shown in the sputum, it is supposed to be the diagnostic test of tuberculosis. It confirms its diagnosis of tuberculosis in this patient. But the problem with the sputum examination, the sensitivity is not very high, it's up to 30%. So even if the patient has tuberculosis, there is a possibility that 70% of time, his sputum may not detect the tubercle bacilli. And therefore, some other alternative tests may be required. So as a matter of fact, now we've got good quality, reliable tests available, which are called the molecular tests. Which detect the DNA of the tubercle bacilli. And the important thing is that these tests can detect even a small number of tubercle bacilli and give the diagnosis quite accurately, even though the sputum burden or the disease load may be low. And the test result can be obtained within 2 to 3 hours. And the test can also tell us whether this patient has got a resistant tuberculosis or sensitive tuberculosis. So this is about pulmonary tuberculosis, lung tuberculosis. Then we have the test for extra pulmonary tuberculosis, which is called as tuberculosis other than the lungs, where the samples from those areas are subjected to various tests to diagnose tuberculosis. So anybody who is coming with a history of cough, fever for more than 2 months and got a weight loss, maybe blood in the sputum, we do advise just X-ray in these patients. And X-ray can show, the findings of tuberculosis. But again, the sensitivity to the X-ray is not very high, and many times we may have to do a CT scan, which gives us much more elaborate picture of the tuberculosis. But one thing that we have to remember is that the X-ray is not diagnostic. You do not diagnose tuberculosis on the basis of X-ray or the CT scan. They give us a high degree of suspicion that yes, this could be a tubercular lesion. And then we have to resort to diagnostic tests, such as, the sputum examination. And many times we may have to, do a small endoscopy in these patients, which we call as a bronchoscopy, where a small camera with a tube is, passed into the lungs through the airways. And then, the sputum and the bronchial secretions are collected for sputum for the examination. So X-ray gives us, and the CT scan give us a good idea that yes, the patient could be having tuberculosis, but then it has to be confirmed either with the microscopic examination or by the molecular tests. So, the TB control program has been there in the country for many, many years, and the government is working very hard on this. And after, Prime Minister Narendra Modi, set an ambitious plan of TB free India by 2025, and new life has been infused in this TB control program, what we call the TB eradication program. And at every level, the government is working, whether it is a block level, village level, or city level. The efforts from the government are enormous. So if suppose a patient of tuberculosis is detected, the government also pays them incentive every month for their good diet. And the facilities of diagnosing tuberculosis is now widely available. Even in the villages it is available, in the block level it is available, where TB can be diagnosed easily and rapidly. So problem is not with the implementation of the government policies, the problem is more with the myths which are associated with tuberculosis. People don't want to accept that they have got a tuberculosis, or even if they have got a tuberculosis, they would like to deny that they have a tuberculosis because they think TB is a disease which is sort of a stigma on them, on their family, especially if a girl or woman is affected. So they would keep suffering and they would not tell anybody, and in the meantime they will be keep infecting. For TB control is very important, the case detection is increased as much as possible, and the treatment should be started as early as possible. Because an undiagnosed case of tuberculosis would keep emitting the tubercle baseline and keep infecting others. So it's very important that we detect cases, diagnose cases of tuberculosis as early as possible, and treat them as early as possible, so the disease gets cured. And not only the disease gets cured, but this also prevents the spread of infection to others. So the message is very simple, that TB is a disease which is curable. We should not be afraid of it, and we should come forward if we have symptoms of cough, fever for more than 2 weeks. Should get ourselves investigated, get ourselves diagnosed properly in time, and get rid of this disease, so that we can also prevent infection to our family members and to our friends and to the community.